Hi, I am Dr.O.S.Siva Prasad, consultant pediatrician and neonatologist working at Cloudnine, Thanisandra, Bangalore. So many parents often confuse between just a speech delay in a child and autism, because these are the common terminologies where we always hear for the parents whether my child is having speech delay or whether my child is having autism. So both are completely different. So first, just understand the basic terminologies. Speech delay is nothing but when a child is not able to express or speak certain words which are known to be normal for that age. For example, the child should start babbling by around 6 months of age. Before 1 year, the child should start speaking at least bisyllables and at least responding to their name. And when by 1.5 years, at least the child should be speaking at least one meaningful word. And by 2 years, most of them form two-word phrases. By 3 years, most of them combine three-word phrases, and by 4 years, most of the speech will be very clear. So if a child is having expression in speech, like expression in the words, so is not happening on par with the other children, or not on par with the normal child at that age, that is called as a speech delay. So it is completely different from autism, because speech delay can be isolated also. So some children can have only difficulty in expression of the words, but they can be able to show their needs, finger pointing, they will respond well to commands, they will do other things very normally, other developmental domains will be absolutely normal, and they don't have any behavioral problems. Speech delay also can happen in an autistic child, but autism is not diagnosed only with a speech delay. So autism should always have, apart from speech delay, most commonly they will have social interaction problems, communication problems, or restrictive behavior or behavioral issues. For example, the child might not respond to the name by the end of 1 year. The child will not have an eye contact while speaking to you, or the child might not be interested in playing with the other kids even when they are in a group, and the child might not be interested in what you are doing, and he will be always trying to be alone, and they always prefer to have a repeated behavior in very particular interest in playing or even speaking also. So many children might have a repetition of words, which is called as echolalia. They will have sometimes have repeated behavioral movements also, so like spinning in rounds, or they will have repeated movements of flapping of hands, like that. So speech delay can be isolated, so not associated with any other disorders, but speech delay can also be a part of autism. So not all the children with speech delay are autistic, so it has to be evaluated by a pediatrician or a developmental pediatrician and differentiate between the both. Whenever you find a child who has a speech delay, always take an advice of pediatrician and make sure other things are normal.